Good evening, dear friends. Since there are quite a few intellectuals among my viewers, here's a riddle for you. What is the longest nerve in our body? The correct answer is the sciatic nerve, as you may have guessed from the title of the video. Friends, the longest nerve is the sciatic nerve. It's also one of the most vulnerable nerves. Sciatic nerve syndrome. It's accompanied not by excruciating, but by rather unpleasant pain. It depends on how much it gets compressed. And at the same time, the buttock hurts, the back of the thigh, the calf, the back of the lower leg, and even the foot. This can also be accompanied by numbness, and it can be accompanied by weakness in the leg. First of all, what should you do? You need to rule out a hernia, because the same symptoms can occur when a nerve root is compressed. Ideally, you should get a magnetic resonance imaging to check, but sharp pain can occur in both cases. If a hernia is ruled out, so if your disc is intact, nothing is compressing it, and the nerve isn't damaged, then it means the nerve is being compressed after it leaves the intervertebral foramen. Look right here. The spinal cord runs inside the spine, and between the vertebrae, the nerve roots come out. See, these structures here. This is the nerve root. This is the spinal ganglion, the node, and the nerve root. Further, these are the roots. They join together to form nerve plexuses, and then from these plexuses, they branch out into different nerves, including the sciatic nerve. After exiting this intervertebral foramen, we also need to rule out nerve compression within the iliopsoas muscle, The quadratus lumborum muscle is also involved in this. So, if we have ruled out their compression as well, then we can be 100% certain. We move on to the sciatic nerve. We move on to the sciatic nerve syndrome. So, what is compressing it? When does the nerve malfunction? When is it unable to function properly? First of all, we need to check if it is being compressed by anything. Here it was compressed by a hernia after it exits the intervertebral foramen. It can also be compressed by arthrosis of these intervertebral joints. All of this, here they are. All of this we have ruled out with you. Let's move on to the part where our sciatic nerve passes. It dives in here and comes out here, directly next to the piriformis muscle. The piriformis muscle is usually located above the sciatic nerve. There are many mutations. Maybe you're a mutant, or maybe I am. We will only find this out after a diagnostic autopsy, or if you're interested, you can also get some tests done. Well, in short, in some percentage of cases, the nerve doesn't go under the muscle, but actually passes through the muscle, right through the piriformis muscle. And in this case, even a slight spasm of the piriformis muscle will already provoke these more unpleasant sensations down the leg. The first is the piriformis muscle. Its spasm causes compression of our beloved sciatic nerve, which, by the way, is formed in our body by the nerve roots that all come together here from the 5th lumbar root. And here is the sacral root, right here. All these roots, the 5th, the 4th, and the sacral roots came together. That's how they all form together the sciatic nerve, which passes under the piriformis muscle and comes out on the back surface of the thigh. It's all here. It's not that simple, of course. Here it's schematic, we're just drawing it all. Here they go like this, right here. Here it comes out from this opening like this, you see from here. And right here it's immediately covered by the piriformis muscle, like this. This is schematic. That's how we've depicted it. On the back surface of the thigh we have two muscles. The first is the biceps femoris. the biceps, the two-headed muscle. There's a biceps not only on the arm, it's also two-headed, the same named muscle you see on the back surface of the thigh. Because it has two parts, it's two muscles combined into one. Why isn't it two separate muscles? That is, in the upper part it starts with two different tendons, and in the lower part it merges into one muscle and attaches with a single tendon. And here on the inner part of the thigh we also have two muscles. The semitendinosus muscle is called that because it has a very long tendon. Half of the muscle is tendon and the other half is the muscle belly. And the semimembranosus muscle also has a strange shape, and it also has the same inner surface. Also, the sciatic nerve can be compressed in the area of these muscles. When the muscles on the back of the thigh spasm, it can also irritate the sciatic nerve. In this case, there will be pain. If compressed here, the pain will be felt throughout the entire leg, and if compressed here, there will also be pain. And the pain will radiate both upwards and downwards around this area here. But of course, there is also a possibility of compression right here, which is already the continuation of the sciatic nerve. This is the common peroneal and tibial nerve, and they can also be compressed there. But here we also need to relax the calf muscle more in order to reduce the overall tension of the fascia along the entire back of the leg. So friends, the main thing, what do we need to do to release the sciatic nerve, to get rid of pain, tension, and limited movement caused by pain in the thigh? One symptom is sharp pain when bending the leg, making it hard to walk, causing a limb pain, weakness, and sometimes numbness in the leg or toes. What is the main symptom? When you're lying on your back and someone lifts your leg, you feel a sharp pain. If you bend over yourself, you also feel a sharp pain. So it's a limitation caused specifically by pain, which spreads throughout the leg into the buttock and the back of the thigh. So, relaxing the piriformis muscle. If we just start relaxing it, usually it won't lead to anything, or it will only temporarily relieve our condition. Usually the piriformis muscle isn't injured directly, even in most cases. It's the nerve that's affected, not the muscle. It's connected to the weakness of the gluteus maximus muscle. When the gluteus maximus is absent, the piriformis muscle starts to get overloaded and tries to help out. So the bigger the gluteus maximus muscle, the less strain there is on this small muscle. The smaller the gluteus maximus, the more the piriformis muscle gets loaded during normal, everyday movements. That's the first thing. Second, even while sitting, the sciatic nerve can get irritated when you're sitting on your gluteal muscles on the back of your thigh, as we often do. If there's not enough muscle mass there, then there's also a constant irritating traumatic effect on the nerve, simply because there aren't enough muscles to cover and protect it. And for us, it's mainly the gluteus maximus and the biceps femoris plus the semitendinosus and semimembranosus muscles.
Hi guys, the doctor recommended me a great blood pressure monitor. Easy to use at home, accurate and reliable.
So if you already have pain, it's too late to start training. You should have started your training 5 years ago when your gluteus could still contract at least a little. But that won't happen anymore if everything already hurts. Now your salvation is in my hands. Which one will you choose, the right or the left? Here, it doesn't depend on your choice. One thing you'll need to do is relax the muscle. How? There is an ancient method invented by Soviet manual therapists, and in particular, the founder of manual therapy. The surname is Ivanchev. I don't recall the first or middle name, just Ivanchev. He authored the manual therapy textbook. He invented such a method. Well, not invented, of course, more like he offered scientific explanations, so to speak. It's called ischemic compression. If we take a tense muscle, one that has increased tone, for example, this muscle here, it's tense and there's a painful area in it, a trigger point. If I press on it and hold it like this for about 30 seconds, the muscle will reflexively relax. That's ischemic compression. Why is it called that? Because when I press on it, I'm compressing the blood vessels that go to this tense area, and this tense area reflexively relaxes. And I need to do the same thing now with my piriformis muscle through the glute. Because the piriformis muscle is located under the glute, I will press directly on it, right in the area of the piriformis muscle. It's located right here. You see, from the sacrum to the femur, that's where it is. When will you do this? It's possible that if you're in a period where the nerve is pinched or inflamed, you might feel pain radiating down your leg. In this case, use a smaller, softer ball. Be down on something soft and reduce the pressure. That's why it's better for you to start near a wall, because here you can control the pressure, press a little more or a little less. Turn at one angle, then a little at another angle, and try it while moving. So your goal is to relax a bit, but at the same time, when you apply pressure, the pain in your leg shouldn't get worse. It should actually decrease, because if you're in an acute phase and your nerve is being strongly compressed, your goal is to relax, not to make it worse.
That's all there is to it. The second option is lying down.
But there are also more precise ones like these. Yes, you can use these massagers too. That means it's a more precise effect. It's better to switch to it when you've already relaxed a bit. You also place it here, put it here, and more precisely like this. You stood for a bit, held it, that is with the ball. You can relax the muscle while moving. And with things like this, what's it called? A massager like this. A massager of a specific type, cone-shaped like this. You use it for precise effects like acupuncture, so-called, while lying down. You lie on your back. Put the ball under your buttock, and here you are. You can also bend your legs, turn a little, find the painful area, and lie like this for a while. And straighten one leg, straighten both legs, move the ball from one part of the buttock to the other. That is, you can go over the entire buttock, all around the edges, like this at first. That is, don't try to hit the piriformis muscle directly. You're not even working directly on the piriformis muscle itself. And for example, if you hit the gluteus medius, there will also be a reflex effect on the piriformis muscle. Because if you relieve a spasm, for example, in the gluteus medius, it will be easier to work. The gluteus maximus and piriformis muscles will also relax a bit. So basically, you can go over the entire gluteal area, try to relax everything. And in those areas where the pain is more noticeable, you stay there a bit longer. Find positions where you can feel it. Well, more something like that. If you feel tension in the muscle or the pain is stronger, you stay there a bit longer. Well, so you only move to lying down after you more or less stop feeling it while standing. Next, you use this position. You place your leg like this. In this position, your piriformis muscle will already start to stretch a little. You can also change the position, lean a little to one side, then a little to the other side. So in this position, the angle changes a bit. The piriformis muscle itself gets stretched, and here you work it out from a slightly different angle. There. So that's what concerns the piriformis muscle. Now, the back of the thigh. In the same way, you should be able to relax it. For this, a ball, like The one you just used will work well. And for the back of the thigh, massage rollers also work very well. These ones, also small in size, are more convenient to use while sitting. You place it and roll across the fibers like this, back and forth. Divide the thigh into the inner part. This is where the semitendinosus and semimembranosus muscles are. Massage and work them along the entire surface, starting almost from the glute, and work the outer part of the thigh the same way. Where you find a painful area, stop and spend a little more time there. Alright, now do the same thing with the ball. Here, it's good to get right between the muscles, that is, between the biceps femoris and the semitendinosus muscle. In this spot, you'll be pressing into the inner part of the biceps femoris. If you press and feel that your leg is going numb, reduce the pressure. That means you've hit the nerve a bit. You shouldn't press directly on the nerve, so you need to relax everything around it to make it comfortable for it. More space, so that nothing pinches it anywhere. Work through the entire back surface of the thigh. You'll find areas of muscle that are more painful. Spend more time on those spots. So you need to try it the first time. After that, you'll know yourself where it hurts more and where it hurts less, where to spend more time and where to spend less time. And you can also try after that, once the pain has calmed down a bit and there is no sharp pain. You can try different methods of stretching the piriformis muscle. One of the ways, well, you can try it while sitting first. This is when you sit with one leg over the other, placing it like this. If it's short, your shin won't be parallel to the floor. So first, you try to position your shin parallel to the floor. It will already stretch a little like this. Then slowly try to lean forward. If you feel sharp pain in this position and it doesn't let you stretch the muscles, then try doing the same thing while lying down in the position where we just massage the muscle. Even in this position, it will already start to stretch a little. And from here, you can try to take this leg and slowly pull it toward yourself like this. Lie down on the pillow yourself to make it more comfortable. This way you can try to stretch it. You can, but if your acute pain has already passed, you can try placing your leg a bit higher. Well, for example, even like this, you can put it on a chair like this and try stretching it a little. It will also help you stretch it. Like this, you don't need to pull it forward, just up to here. If the process is still acute, you could damage the nerve even more. So, if you have pain in the back of your leg, the most dangerous thing you can do is start stretching the back of your thigh. Because if your nerve is compressed here and you start stretching it even more, it will hurt and become inflamed. This should be done as a last resort or not at all. And you also need to put some load on the gluteal muscle, osi shobolshobastri. But make sure it's not enough to trigger even more aggravation. What exercises are suitable? A good one is when you lie on your side, put your feet together, and from this position, lift your knee upward. You don't need a large range of motion here. The gluteus medius and maximus muscles are working. This exercise is also good where you lift upward, the gluteus medius is engaged and then a little forward. So there's no tension in the leg. You can even bend your leg and this kind of lift as well. So these movements are pretty good. They will engage the glute muscle itself and take the load off the piriformis muscle, but not for everyone. For some people, for example, these movements can actually make the pain even worse. So you need to try, give it a try. For example, in this position, try to make the movement. If everything feels fine, keep doing it. For some people, it will be easier to do this. For others, this movement might make the pain worse. If you start doing the exercise and feel that the pain gets worse, it means this one isn't right for you. You should try a different one. So it could be one of these three or all three. And it's also a good idea, if lying down doesn't help or it's painful, to do it lying down. You can try this one. So you bend forward, and from this position you move backward. Here too you can adjust the range of motion. Here your glute muscle, this one, will be working. Or you can move at a slight 45-degree angle like this. Your foot is also turned 45 degrees and you move in this direction. So in any case, one of these exercises will work out, but usually this is the one that should work out. You don't need to lift it high. Just a small movement is enough. The point of this exercise is just to tone the glute a little and the back of the thigh, to take the load off the piriformis muscle. Well, my friends, a lot of work has been done. Of course, it's useless for those who just watched out of curiosity, but overall, there's a certain sense of satisfaction. That's right. That's why we do sports, help our parents. See you in the next episodes. Share your admiration in the comments, to be continued. Also, we describe it in detail.
Hi guys. The doctor recommended me a great blood pressure monitor. Easy to use at home, accurate, and reliable.